In the middle of the year 2007, my wife Christine and I found ourselves with great news. We were having our first baby. A series of preparation for his birth ensued. He is to be born in the middle of April of the following year. Then one night in December, the 23rd week of pregnancy, Christine felt a cramp and found a spot of blood. This is the turning point of our life as we know it. Christine called her obstetrician, and then we headed straight to the hospital. We eventually found out that it was placental abruption. It is a condition where the placenta has prematurely separated from the uterus. This happens in about 1% of all pregnancies worldwide. And if it was not bad enough, she also had placenta previa, in which the placenta grows in the lower part of the uterus. The implication of this was serious and life-threatening for both Christine and the baby. That night, we decided to pick a name out of a few we've selected already. Christine liked Jonathan. I also like Lance as it symbolizes strength. From then on, we knew our son's name will be Jonathan Lance. Christine spent 3 weeks on complete bed rest to avert early labor. She was also on continuous fetal monitoring, and she's also getting magnesium sulfate drip to keep Jonathan from coming out early. Christmas and New Year's passed, but on the morning of the 9th of January, Jonathan was born. He was 2 pounds and 4 ounces, barely breathing on his own, but was strong and healthy. It was such a joy for everyone in the family to finally see him and hold him. He then went to the ICU as soon as he was delivered from the labor room. Jonathan, other than being in a ventilator and feeding tube, seems to be doing just fine. A few days later, Jonathan's nurse noticed an unusual twitch in his face and arm. The nurse thought it was a decorticate posturing. Decorticate posture is the abnormal flexion of hands and feet. It is usually associated with brain injuries among children. Jonathan's nurse told the ICU doctor, and a series of tests was done immediately. We found out that Jonathan developed bleeding inside his brain. The condition, intraventricular hemorrhage, is a bleeding into the brain's ventricular system where the cerebrospinal fluid is produced. This is very common among premature infants like Jonathan. His IVH was grade 3 and 4, which has long-term implications. And to complicate this situation, he also developed an infection in his central venous catheter. This held up the opportunity to move him to Texas Children's Hospital for the appropriate care that he needs. Eventually, Jonathan was moved to TCH 21 days later. At TCH, we were hopeful that the treatment would start right away. The succeeding days that followed were like a roller coaster ride. Every day was a surprise. Some days are good and others are not. But eventually, Jonathan had a VP shunt placed on the 28th of March. He also had an eye surgery for his strabismus. He still has stiffness in his left arm, and his legs tend to cross when standing. Jonathan is a happy kid just like any kid his age. There are times when we feel frustrated as Jonathan struggles to do things like a toddler of his age. But in hindsight, he has accomplished more than what we can hope for. He is truly our miracle.
Please don't worry, my brother. In this world we are all the same. We must find peace. We must find it together. It's not far away from your heart. You've got the good vibration.
Let your heart follow the rhythm when the voice gives you emotion. You have to feel peace when the butterfly dances in the sky. When you want to sing what what you like. You've got a good sensation.